Okay, so I'm here with Jenni. And Jenni, can you tell us what it was that brought you to our clinic? It's been a bit of a drive for you. What brought you to our clinic?
A friend recommended you, actually.
Mm-hmm. And what kind of things have been going on?
That is a very long story. A lot of things have been going on, and I suspect a lot of people that come to your clinic,
Mm-hmm.
it's because a lot of things are going on.
Correct.
And starting when I was 11, I got sick. I had respiratorily, I got complications. I have digestive issues. But the biggest thing that has defined my life since I was 28 is chronic, unending pain.
Okay. So you've had a ton of stuff plus chronic pain for years,
Mm-hmm.
many, many years. What kind of things have you done in the past for the pain and for everything else?
When it first started, it was triggered by surgery. When it first started, for the first few years, I did physical therapy, and I tried chiropractic things.
Mm-hmm.
Pain pills at that time weren't really on my radar.
Right.
I don't know why. So, I mean, obviously I had pain medicine in the wake of the surgery,
Right.
but my focus was on other things.
So you've had surgeries, you've had medicines and treatments and everything that you think of.
I eventually ended up at pain clinic.
Yep. And they use pain medicines.
Oh yeah. But my pain, eventually I would get used to the pain medicine, and they'd raise the pain medicine.
So you get on these bigger and bigger doses,
Mm-hmm.
and you get more and more
Exactly.
worked out, and you still have more and more pain despite being on bigger and bigger doses.
Yeah.
So you've been down that track before.
Oh yeah.
So what did we do for you? How did we treat you?
Well, the first thing is you treated me with respect.
Thank you.
And you treated me as if I had enough value that you would at least listen to what I had to say. And you started from the beginning. You didn't just ask me what my issue was right this minute.
Mm-hmm.
You went back and said, explain to me your health history.
Yeah, it took a while to do that.
Yeah, it
Yeah.
did. But that's important because for people who have a lot of issues and end up at a lot of different doctors, each one unwilling to treat something not under their purview, it's important to have a doctor who's willing to look
at the whole thing.
Everything.
Good. And so we've got a good history, we've got a good physical on you.
Yes.
Then what do we do?
The very first time you did, the technical name is what? Reflexive neural...
I call it neural reflex therapy.
Neural reflex therapy. Whatever.
It's a manual therapy that tends to stop pain.
Right. Whatever it is. When I first met you, I had injured my foot.
Oh, yeah.
My left foot, which I had had surgery on many years ago that started this. And I was in a great deal of pain in that foot. And you said you wanted to, do this.
Did we stop the pain?
Yeah.
Has it come back?
Not really.
I'd forgotten to ask. Because I forgot
Not
about your foot.
really.
It's done really well.
And in fact, I am still wondering why it healed so quickly.
Yeah. So, okay. So we had multiple surgeries, but we saw the pain has done great. Okay, so what else did we do besides this manual therapy? We've done it in a few places on you too. And
yes.
Places where we had terrible pain.
Well, that's the thing is my pain has increased not just from my foot, but over the years, I was on crutches so long that my wrists hurt and my back hurt from being hunched over.
Yeah.
And I started just sleeping sitting up.
Yeah.
And so pretty soon everything hurt.
Right.
My jaw. And you did the same therapy on those places. And I wake up.
It helped a lot.
Yes. I'm also on the LDN.
Okay, so we also did LDN, which is a medicine that actually blocks narcotic medicines.
Yes.
It makes them so they don't work, but it helps with chronic pain if you take just that without the narcotics.
Right.
And has it helped you?
I know it has. It has helped the pain, but not completely. And that is how I know that the other places you've done this reflexive therapy has also helped. They have both helped.
Yeah.
And like, I'm sitting here right now in absolutely no pain. And
No pain.
Well,
let me ask you this. Before I saw you, when was the last time you had no pain?
Before the age of 11. But certainly after the age of 28, when it really kicked into high gear. Ever since
so
then,
pain-free. That's pretty stunning.
It's hard to survive.
So, and we won't go more into the details of this whole thing, but we've got the pain a whole lot better, and we're working on some other stuff as well, and hopefully we'll do another one talking about all the other things too.
Yeah, I feel like I have a long way to go still.
Yeah, but at least the pain's under control, which is a really, really good start.
Yeah.
What kind of a difference has this made in your life?
Actually, there was never a time that I ever considered what I wanted in my life because I was always too busy recovering from being sick or being in pain. And so I know I've mentioned it's very disorienting.
So
I find myself looking around
thinking, now what do we do?
This can't be. Where's my pain?
Exactly.
Not that I want it back, but and not that there won't be days that I might, things will be worse or things will be, but I think I'm having, at some point, I hope maybe I'll grow the courage to try what I really want out of life.
Yeah.
But
see what you want to be.
But
you never had
I
a chance
failed
to
so
dream
many
that.
times because of the pain and because of the health issues that it's scary. But I do know that I am always thinking, don't laugh because I'll be in pain.
From hurting. From in the chest.
Yeah. My whole
but you can
life
laugh now.
Evolves around that. Yeah. And little things like that, I'm still remembering that it's okay to do that. So.
Okay, Jenni, thank you so much. Is there anything you want to share with somebody who might be watching this?
I guess what I would like to share is that there are no guarantees in life.
Yeah, we won't guarantee.
There's no guarantees. You could, who knows? You could come and you could see Dr. Vance and it won't help you at all, maybe. But what I can guarantee you is that he will try everything he can think of. Yeah. And it's unusual. It's unheard of in my life to have run across a doctor who really even cares.
You've seen a lot of dogs.
Yeah.
You've seen just about all the dogs. Yeah, you've seen everybody. Okay. So, Jenni, thank you so much. Do you mind if we put this on Facebook, YouTube, website, advertising stuff, that kind of thing?
You can put it wherever you want.
Thank you so much.